Disinfecting after every patient is the new reality for Dr. Javed Alloo. Alloo is a family doctor at a busy clinic in Toronto. And as a frontline worker, he knows he's high risk for COVID-19.
It's hard to accept that we actually might be at more risk at a higher level than the average general public who can afford to stay away. We can't. Every day we're back here.
Dr. Alloo knows that's part of the job. He worked during SARS. In fact, that's how he ended up in this clinic.
The doctor that I replaced was a victim that he died from SARS. And he caught it from a patient he was taking care of. So that's the reality. But you're a national.
Alloo was just out of medical school when SARS hit. He was asked to fill in at this clinic. 3 of the 4 doctors were hospitalized from the virus, one of them in critical condition.
And one day the nurse came in crying and saying he's passed away. And so we all knew that the person that they actually had been working with for so long, who had been taking care of patients with them alongside every day, wasn't going to be coming back after SARS. And it created a strong bond between the patients that I inherited. And this is a relationship that's lasted till today. This is something that actually has brought us together, recognizing the common humanity and the risks that we take together in actually getting care when we need it and giving care when we can.
They just told me that my office is officially closed.
So now when Dr. Alloo meets his patients, like Maria DeMuro, he remembers a lesson he learned during SARS, when he had a near miss he'll never forget.
And I remember this one man, and this is the first time I met him, and this is right at the peak of SARS. I did his annual checkup, his physical examination, something we would routinely not want to do right now. We're deferring them during COVID for a later time, saying, hey, you're well, let's leave that assessment for later. And during the examination, I realized he had cancer. And so there I was wearing full gear with the mask, the gown, the gloves, the most barriered way of humans talking about something this horrible. And I had to tell him, hi, I know we just met, but I think you have cancer. And then I had to plan for him to get his care.
The man had his surgery 3 days later and survived. He's still one of Dr. Alloo's patients today.
I don't know if he realizes, every time I see him or his family, I remember what he went through during that time. And right now, it actually makes me worry about the people we won't be taking care of because we're so worried about COVID that we're going to defer their care. Who won't we save? Because we're so distracted by COVID right now.
17 years since SARS, that's an important lesson to help us today. Nick Purdon, CBC News, Toronto.